all of you for attending the second climate forum here in the Pinery Room on the fourth Thursday of the month. This is the second one we've had. We hope to have 10 of them leading right up through October, the month before the election. Special thanks to all of the organizations sponsoring today's forum. In case you'd like to learn more about any of them, I ask that members of each organization raise their hands when I mention the organization. And the organizations are the Stevens Point chapter of Citizens Climate Lobby. So somebody around you probably is one of those folks. The next is the Aldo Leopold Audubon Society. 350 Stevens Point. Over here and over here. Interfaith Community for the Earth. Some in the back of the room, some in the front of the room. All right, great. And the Frame Presbyterian Green Team. Come on in. We got plenty of chairs over here in front. Got 3 in front for you. We were saving them for you. We knew you were coming. And so, Frame Presbyterian Green Team. And thank you. And a round of applause for all of our sponsors. Again, I'd like to thank the individual who came up with the idea of these 10 forums, even though she hates it every time I do this, and is devoting her time and her money and her extraordinary baking skills to the enterprise. And all I ask is that she raise her hand in the back of the room. There she is back there. Okay, one seat here. If anybody's got a seat open next to them, why don't you raise a hand so we've got seats all over. As you can see, in various places. One here, one there, one over there. Welcome to sit wherever you like. I got to know our speaker today about 3 years ago when he was attempting to organize a chapter of Citizens Climate Lobby, and I got to do 2 presentations with him. One was for the Waupaca Morning Rotary Club, which, by the way, begins each of their meetings with a musical performance by a band in which the drummer is our presenter this evening. The second time was when we conducted the group start meeting for the Waupaca chapter of Citizens Climate Lobby. I later learned that in the 1980s he worked for the U.S. Public Health Service in Alaska, and I'll let him pronounce the name of the town because I can't. He now serves as a family physician in Waupaca as well as the leader of the Waupaca chapter of Citizens Climate Lobby. Please join me in welcoming Dr. Paul Sletten.
How many events can take one or 7 events per month?
Hello, good evening. I don't have a microphone, so I'll speak really loud. And if you can't hear me in the back, please let me know. Can you hear me in the back now when I speak? Okay. All right. So, yes, I'm a family physician in Waupaca, Wisconsin. I'm a full-time family physician. It's what I do full-time, 5 days a week. I'm old enough now they don't make me work at night. But I do that as my full-time job, and actually 3 years ago I didn't really know how I could get time to do something like this. But it's very energizing, and it's so nice to see all of you here. I think there is a momentum that is building for a non-political sort of look at climate change. And so it's really exciting to be part of that. And I would start out by saying thanks to Dan Dietrich for giving me an outlet for my frustration. So, as he mentioned, I had the privilege of working for 2 years, 4 months, and 14 days in an Eskimo community above the Arctic Circle. That was in 1985, before many of you were born. 1985 to 1988. I lived right on the ocean and became addicted to an activity called dog mushing, dog sledding, which I did for 25 years. But I couldn't have done it without my wife, who was sitting right here, helping us take care of 15 sled dogs, and I'm still working full-time and raising children, 3 children, and my daughter is sitting here tonight. Are you still able to hear me in the back? Still able? My voice gets a little softer. So I'm not a climate scientist. I welcome this talk because it's focused me on data and information. I'm not a climate scientist. I'm a family physician. So I'm hoping what my role here is to again expand conversations, help you make connections with where you work, with what you do, so that we can expand what we're doing. I'm very honored to be here. Thanks to all the groups that came together to make this forum. Very excited to be here. So I lived above the Arctic Circle. My wife says I froze half my brain when I lived there, and I'm always trying to freeze the other half. And I don't think I've quite succeeded. So let's see. I wanted to read. Back up to this picture. I'll put that or not. Yeah. I guess we just go to one back. And while my colleague is doing that, we want to go back to the picture of it is not working. Let's see. Here we go. That's all right. I'll just do this. That should not. It's not on the screen. We won't worry about the technology. We got it. If we got the technology, we got it. We don't. Okay. So this is dog sledding. Yeah, the computer doesn't really like this. But this is me, wild and crazy, on the left, and that's my daughter on the right. And again, we did this for. So the idea here is we're going to slide into the presentations. And Lily and I are going to help you slide into this. This is an amazing book. I'm sure many of you in the room know this book. There's a paragraph here that I really like. It really sets the stage, I think. And again, let me read this. Merchants of Doubt. Imagine a giant banquet. Hundreds of millions of people come to eat. They eat and drink to their heart's content, eating food that is better and more abundant than at the finest tables in ancient Athens or Rome, or even the palaces of medieval Europe. Then, one day, a man arrives, wearing a white dinner jacket. He says he is holding the bill. Not surprisingly, the diners are in shock. Some begin to deny that this is their bill. Others deny that there even is a bill. Still others deny that they partook in the meal. One diner suggests that the man is not really a waiter, but is only trying to get attention for himself or to raise money for his own projects. Finally, the group concludes that if they simply ignore the waiter, he will go away. I'm so glad to see you all here because we're not ignoring the waiter. Wonderful, wonderful, wonderful book. If you haven't read it, it's up here. So, sliding into the presentation. This next slide is the general working of this. So, as the climate changes, we have at the top, we have what are called the climate drivers. And I'm really, really sorry about this. I don't know what the technology is. increased temperatures, precipitation extremes, extreme weather events, and sea level rise. So those are the things that are happening. The way we're exposed to those things is through extreme heat, poor air quality, reduced food and water quality, changes in infectious agents, and population displacement. So this is how we are exposed to these different forces. And then the health outcomes from those are heat-related illness, cardiopulmonary illness, food, water, and vector-borne diseases, and, very importantly, mental health consequences and stress. And I would argue that many of you right here are dealing with the mental health and stress. I know that's what helped me, was to have an outlet for this sense that I had that my dog mushing was being threatened, that winters were shorter. Where was this going? I remember in the mid-1990s, 1995, 96, going, what's happening? Feeling guilty, feeling ill at ease, feeling like, what is going on? And so having an outlet for action, I think is really, really important. And so that's why I'm so happy to have you all here, happy to see you all here. Applaud the work of your groups to not ignore the waiter, figure out what we can do. And I would argue that everybody in this room has something that they can do, something that you can do. And I'll try to make some of those points here. Again, I'm a family physician. I see people all day long who struggle with a lot of very common illnesses, but as I'll show you later, dealing with some of these illnesses is also very, very, very climate friendly. Let's see if we can make this work. Okay, so lots of information there. So, as you see, we've got extreme heat there on the upper left, more frequent severe heat events, elevated temperatures, heat-related deaths and illnesses. Rising temperatures will lead to increasing heat-related deaths and illnesses. That certainly is happening now. The air quality, I think one of the things that impressed me as I was reading about this is that as the temperatures rise, ozone levels rise as well. And so you can see definite increases in emergency room visits for children with asthma as the temperature rises and the ozone levels rise. So there's a direct correlation there between temperature, ozone levels, and emergency room visits for people with chronic respiratory illness, such as asthma. Flooding, obviously, flooding has its health risks. I don't know if any of you were in Madison last year with the flooding. I don't know if anybody here in Madison last year with the flooding. Okay. Certainly health effects from that. There were deaths from the flooding, as you know. So flooding is certainly a big issue. Vector-borne illnesses. As most of you know, you live here, the tick population is seemingly forever increasing. This is a map of on the left is 2001, the incidence of Lyme infection, and on the right, in the moving, wobbling screen, is the 2014. So as the temperature changes, these insect vectors, their range increases. And so you see this rather dramatic moving screen here. That's it's actually calculating in real time.
this. The next, these slides again talk about the incidence of deaths over on the right related to ozone. So I've got some references here on the end of the talk, but they can calculate based on the temperature models between now and 2030. They can calculate the incidence of disease and specifically ozone-related deaths between now and 2030, and that relationship is very, very clear. As the temperature rises, expected deaths rise from ozone-related illness. So this is Lily when she was littler, and I'm sorry that it's moving. It's just it's a priceless picture of what do we do? I think everybody's here because we know something is happening. We've seen the water tables rise. I talk to hunters all the time who talk about how all of their land that they normally hunt on is underwater. Everybody knows something is happening. So the real question is, what do we do about it? And so there was a wonderful article that I took to heart called "How to Stop Freaking Out About Climate Change," and it was in the January New York Times editorial section. How to stop freaking out about climate change. Well, aren't we supposed to freak out? Well, really, it doesn't help to freak out. It helps to do something. And so this is where my heart really is. I think ditching the shame. So that guilt that I felt about the climate changing, how am I responsible for this? Am I sort of responsible for having ruined the climate? It's not helpful to be there. You need to get rid of that attitude. It's not any one thing that we did, that any one of us did. You need to focus on the system and not yourself. So, what can we do? What can we do to involve our government officials, our institutions, our employers, private sector? What can we do to involve them in the solution? Another point of this article about not freaking out was join an effective group. There's lots of effective groups in this room. Citizens Time is one of them. There's a number of them, but just join a group. Get involved in something that makes sense to you. There's a lot of groups out there, and you should try to find one that works for yourself. Define your role. There's people in this room that are strong and have strong backs and can lift books. There's other people that can talk in front of groups and not get freaked out. There's other people who can write letters to the editor. There's just a lot of things that you can do. So define what you can expect of yourself. Try to be reasonable so you don't get burned out in the process. And then know what you're fighting for. Know what you're fighting for, not just what you're fighting against. So I think about these wonderful, wonderful, beautiful days that we have, and I think about how much I want to do for the next generation. This is all about 20, 30, 40, 50 years from now. And we all have to continue to think about that. So this is the quote that I got from another source, but let me read it. The belief that this enormous existential problem could have been fixed if all of us had just tweaked our consumptive habits is not only preposterous, but it's dangerous. As long as we are competing for the title of greener than thou, or paralyzed by shame, we aren't fighting the powerful companies and governments that are the real problem, and that's exactly the way they want it. So no holier than thou. I mentioned what I do. I spend my days talking to people about these common issues: weight loss, high blood pressure, diabetes, prevention management of coronary artery disease, chronic lung disease, mental health. That's what I spend my day doing. And as I think about this, I think about what we all can do. There's a nice, very, very nice synergy between taking care of ourselves and taking care of the planet. How am I doing back there? Still can hear me? Okay. All right. One of the big struggles is weight loss. Again, high blood pressure is a big problem. If you think about the treatments for those, if you think about treatment for hypertension, I don't know how many in the room have hypertension. I mean, there's certainly medications, and we talk a lot about medications, but the number one risk reducer for people with hypertension is not to take pills. The number one risk reducer for hypertension is being active, eating right, walking, exercising. So you can reduce your carbon footprint by eating locally grown foods. So foods that were not transported from California to Wisconsin, burning fossil fuel in the process of getting here. You can treat your hypertension by eating well. You can treat your hypertension by walking and exercising. Diabetes, really the same thing. Less refined sugar, less processed food, less packaged food, more stuff that is homegrown, more stuff that is made by you. Reduces your carbon footprint, reduces your glycemic level, reduces your fasting blood sugar. So many people in this country are pre-diabetic, and the treatment for pre-diabetes is exercise and eating right. Chronic lung disease, so many people have COPD and asthma, and so many of our children have asthma as well. And the less they're exposed to pollution, the easier their lung condition is to treat. Coronary artery disease, less meat, more walking. Less meat, more walking. Eating less meat reduces your carbon footprint. Mental health. More exercise, more action, and more connection. More connection. So we're all here tonight connecting on this subject. I know my mental health improves a lot when I can actually do something. And being part of a group energizes you and helps us feel that we're not alone in this dilemma. As I mentioned, more locally grown foods benefit people and the environment. Walking and biking friendly cities benefit the people, the environment, and the healthcare organizations supplying their care. I'm hoping there's some healthcare representatives here listening to this. The healthcare industry produces almost 10% of global CO2. 10% of global CO2 production comes from healthcare organizations across the world. So I would encourage you to think about that and think about who your health care provider is, and think about how do they get their energy? How does that healthcare organization get their energy? Maybe they should be asking for clean energy from their energy suppliers. Maybe there would be less asthma in Appleton if there was more clean energy used. So there's a financial part to this too, and works very synergistically with the idea of reducing your climate footprint. Healthcare organizations need to be responsible global citizens and actively reduce their footprint to help their own patients and their own bottom line. Community planners need to encourage more locally grown and marketed foods along with more biking and pedestrian-friendly roadways. Communities can actually market these to attract new industries and families. If we aim for a temperature rise less than 2 degrees centigrade, so they can actually calculate now, based on climate models and population models, they can actually calculate that if our goal in the next 10 years is to stay below 2 degrees centigrade rise, there are amazing financial benefits from doing this. And again, if you want the references, they're here, but the studies are actually putting some dollar figures on this so you can actually talk to healthcare providers and talk about finances and money. For example, in Wisconsin, it's just moving. In Wisconsin, premature deaths avoided annually in 2030, that's 500. Premature deaths avoided between 2015 and 2030, 5,835. Asthma attacks in children under 18, 575. Lost work days avoided in the year 2030, 296,000. And then dollars saved from health benefits annually in 2030, that is $6,547,000,000. So this isn't just taken from the air. These are numbers that are based on population density. Where is the ozone highest? Where are these children suffering from asthma? What are the healthcare costs associated with that suffering? So the synergy is very clear. The synergy is there. You keep that global temperature rise less than 2 degrees centigrade, there are significant financial payoffs. Significant financial payoffs. This is not even talking about the billions of dollars that are being spent to repair the flooding damage and to repair the damage from the extreme weather events. This is actually money saved by making these changes. So I hope I'm making my point. I'll have plenty of time for questions here in just a moment. And you can see in the United States as a whole, it's astronomical the amount of money that could be saved by aiming to keep that temperature below 2 degrees centigrade by 2030. And as you know, there's legislation out there. We can talk more about that, but Citizens Climate Lobby supports legislation that would definitely do this by 2030. It's not impossible. So, I just love this picture. I hope it doesn't mean too much. It's actually one picture. This is the dogs are moving. Now they're running very fast. Anyway, but that's what kind of a future are we running into? And I just love that picture. And there's once more. Lily grew up dog sledding. Her brothers grew up dog sledding. Cheryl has not done a a lot of those things. I'm sorry. My information is on here at the end. Okay. Maybe that'll show up for a moment. The recent Citizens Climate Lobby has captured my heart is that it's focused on a big solution. We're consistent. We're not. We're very, very political, but we don't bash anyone. We don't spend our time tearing anyone down. We say what we want, and we go for it. We're approachable. We form relationships. Anyone is a possible ally in the effort to fight climate change. We're polished, prepared, persistent, and polite. I hope I look polished. All right. Those two references down there, the Health 2016, globalchange.gov, and lancetcountdown.org. These are the Lancet one, 2019, just published in November 2019. So I encourage you to go to Lancet. You can see, you can play with their data. You can see region by region how you might be affected. Let me just take a minute to do that. But this is my information, my Facebook. We have a Facebook page there in Wapaka for our, and then those two references. So I'm going to just change to another spot here, but I entertain questions. Here's what I wanted to show you though about how you can play with the data. This is from the Lancet information. So there's basically information across the country for each state about how much money you can save by trying to stay under 2 degrees centigrade. So I encourage you to play around with this. Go to Lancet, go to that web address, and you can see so much information. And there's much more than you can imagine that's there to see. All right, so I'm happy to answer any questions. Again, I'm not a climate scientist. I really think my role here tonight was to show family physicians are very concerned about this, that there is synergy between drawing down your carbon footprint and your health, that you should be actively talking to your doctor and particularly your healthcare organizations about what are they doing, is your healthcare organization doing to reduce their own carbon footprint and to reward healthy behaviors. We'll stop there and entertain any questions that you might have. Thank you for listening. You have to speak up so other people can hear you.
Okay. I think the most surprising statistic that I saw tonight was that 10% of the environmental effect comes from the healthcare industry. What kinds of things do they do that are particularly bad for the environment, and what are the alternatives?
Yeah, so I did look at some of this information. There is a Harvard Medical School looked at their CO2 footprint and the hospitals associated with Harvard Medical School. I can't tell you specifically what the problems were, but if they're burning fossil fuel to heat their buildings, there's a lot of building space. They're heating all of their medications, but just maintaining the hospitals themselves, I think, is enormously consumes a lot of energy. That was my impression. There's much more information I'm sure that you could get But I think it's okay to say to whatever your healthcare organization is where do you get your energy? If anybody here on any boards for the organizations, for healthcare organizations, Data Care or Spirus, anybody on any of those boards, I think get on a board, get on a hospital board and say, you know, what are we doing? Are we burning fossil fuel and making more asthma? I think that's, but specifically, I don't know, but I saw that 8 to 10% quoted in a number of different articles about healthcare itself. It's kind of surprising, isn't it? Yeah, 8 to 10%. That's a very good question.
So the board of the hospital will give you someone to approach if you wanted to ask them those questions.
Right.
Speak to the board of the hospital.
Speak to the board. I would encourage you to talk to the hospital board or your, I work for Theta Care. I'm not on their board, but there are physicians on there, and I think that's the kind of voice that people should have. And there's a lot of hospital boards who have community members on them, so I think you could certainly ask. It just makes sense. It just makes sense. Healthcare organizations should be asking for clean energy. I don't know, Dan may have some more input on this, but I know that Google offices, I think in Denver, have said, no, you fine, we'll buy energy from you, but we want it to be clean energy. So I think there's some pressure to do the right thing in the private industry. Of course, Citizens Climate Lobby is all about national legislation for carbon fee and dividend, and that's another discussion we can have.
I've been with CCL since we started a chapter here in 2012 in Stevens Point. And I've been lobbying for 8 years. I'll go the 9th year to Washington, D.C. this summer. And what I found is you can reach a lot of people in Congress that are not receptive to an environmental approach by taking a healthcare approach. And there's a lot of people that if you bring knowledge of this sort of thing, and it's not just knowledge, but showing how it's affecting people in their district, if it's a particular congressional district, it really does reach a lot of people, people that you would never dream would be on your side. And sometimes they might not get all the way over to becoming fully on our side, but they're less against us than they used to be. That's really useful in trying to form a coalition in Congress for a carbon fee and dividend or energy innovation and climate carbon dividend act. So
that's a really good point. So it's really about making healthcare the center focus for this transition, for this next decade. Make healthcare the focus, and encourage you all to do that. You can get over some barriers that way. I think that's your point.
because not everybody's an environmentalist.
The other thing I've learned a ton of is I started working hard on this a few years ago. Just listening to what people are thinking is really, really helpful instead of going out there and just jamming in their face because you can get a big face. Yeah. Did you have a question?
Jan?
I was just going to make a comment. I think they will move there when their constituents indicate that we're interested, we're concerned. As soon as they pick up that more of us are following this, they're going to move there. So I think we need to contact them and let them know. I call them when they're not in, so I don't have to talk to them. Leave a message on their phone.
Do you have any tips for, as a young person, to talk to your healthcare provider and ask them those hard questions about where they're getting their energy from, or how they're being more carbon efficient or energy friendly or environmentally friendly?
I think most doctors would look at you like, really? What a question. I don't think I can tell you most of my partners don't really think about this either. but I think we should be. So I don't know the best way to do that. Good.
You were saying, if people eat less meat, if they walk more, if they take care of themselves, that in effect is reducing the carbon impact.
Exactly.
Can I follow up on that for just 2 seconds? It certainly does reduce the impact of the amount of carbon we emit. It is a necessary step for us to take, but it's not a sufficient step for us to take. If we all change our light bulbs in our house, is that a good thing to do? You betcha it's a good thing to do. Will that solve the climate crisis? Heck no. So what we have to do is as he has said, is work together, work in community with one another, and get Congress to act. For a problem that is this big, we can't do it individually. We have to do it nationally and internationally, which means we have to do it together.
When I go to the doctor's office, it seems like there's no way around whatever waste they may create as far as like gloves that doctors need to wear, sterile things coming in packaging. Are there any companies or movements to find a way to reduce waste, maybe like in-house sterilization of equipment and not disposable? What do you see with that?
I can tell you my employer is State of Care, and they definitely have a group within there working on sustainability, and I don't know if it's still in place, but in Appleton they were composting, and I don't honestly know if they're still doing that, but that's the kind of thing that the community where these hospitals are certainly can be offering to help support that. I think is it financially beneficial to the hospital to be composting? But certainly to the community it is. So I think try to get on these hospital boards. If you see any openings for a community member, go for it. Stick your neck out. That's where the magic happens, is when you stick your neck out. Yes, sir.
To that point, one step would be to reverse course and go back to reusable metal and other instruments that can be re-sterilized, which we used to do.
Yep, you mentioned going back to re-sterilizing. Good.
One of the things I see at almost all of the medical facilities is these beautiful green lawns, and they have these signs that say pesticides sprayed, stay off. And it's just, so I'm not usually polite, but I am persistent. So I'm bringing that up again tonight. And I hope you would take that back to Data Care and all the other healthcare organizations, and and if people would write letters to these organizations, they would respond. But especially with our groundwater contamination, that's kind of a ridiculous thing to be doing at our hospitals.
That's a really good point.
Go ahead, Sue.
With the coronavirus outbreak in China and the fact that we've had a month of seeing what's happened when the quarantines were put into effect, and just simply streets, people not driving their cars, not using this fuel. Now, what lesson is there for us? And I do think it's a very strong illustration of all of us being very conscious of how many trips we take in our cars, and I think reducing is a very, very important part of this, and it is something that collectively, Dan, I liked what you said about collectively, because it is going to take us all working together on it.
They just did a study of China's amount of carbon dioxide they put out in a 2-week period this year, and compared it with 2 weeks a year ago, and found out that they had reduced it by something like 200 million tons of carbon dioxide were cut out. They cut out as much as a quarter of the carbon dioxide because of the coronavirus. People are not running their factories, they're not getting in their cars, they're not doing a lot of stuff. This isn't the way we most desire to reduce our carbon. But it is happening. They're also not producing solar collectors. They're not producing batteries, which we need. We buy a lot of our solar equipment from China. And so therefore here in the United States it's hurting us at the same. So it works both ways. But certainly cutting our carbon consumption is valuable. And it can have an economic impact. As was mentioned, I think Ned mentioned, some people are not environmentalists. And many of them are very concerned about money, however. And you should be aware that the largest statement ever made by economists in the United States, and it's how many, 2,000 something, 300 economists from the left, right, and center have signed it, and it was a statement in favor of carbon dividends, which is what Citizens Climate Lobby is pushing for on a national and international scale. So the largest statement by economists is this stuff works. Getting the carbon out of the atmosphere is good for the economy. J.P. Morgan, within the past week or two, released a study they had done, again, a fairly conservative organization, J.P. Morgan Chase. Anyway, one of the largest providers of funding for oil and gas exploration, et cetera, et cetera. They hired their economists to go and find out what is the economic impact of climate change. And the scientists, the economists told them. I can't give you the exact words because I haven't memorized them yet. But what they found was that it presented a threat to human life on this planet. And they talked about the fact that certain steps, if we don't take these steps, we can't come back. There are tipping points, so-called tipping points. You go beyond them, and it's like driving a car. You go off a cliff. It doesn't make any difference how hard you pump the brakes. It's too late. And that's what's going on with climate change. We go far enough, we can't get back. As Dr. Sletten already said, this is not the end of the world stuff. We can do this. It's not too late. I heard a person talk once who said, give up, basically. He says, it's too late now. And that's not what the scientists say. We can deal with this, but we have to get our butts in gear and get it done. We have to make sure our representatives realize what kind of concern we citizens have got on this issue. Yes, sir.
To play devil's advocate, there have been studies that have found that there used to be grass on Antarctica, and there are dinosaurs, they've done all kinds of studies to look at their stomachs. These are things that naturally change within our world.
Absolutely.
And it is like a pendulum that is swinging back and forth, so at some points it goes in one direction, and at other points it comes back there. What are your thoughts on this just being part of the circle of life of us just circling around? Not to say that obviously we aren't contributing to make that pendulum swing a little bit quicker than necessarily if I would have gone, but what are your thoughts on that?
I don't have my slide here. I have a slide presentation on that subject, and it goes back 700,000 years. The planet's been around a lot longer than that, by the way. But it shows that between 700,000 years ago and today, the amount of carbon dioxide in the atmosphere has gone up and it's gone down, and it's gone up and gone down. And the parts per billion of carbon dioxide in the atmosphere have never exceeded 300 parts per million. 300 million. And it goes up and down, and until you get to about 1950, it's a very famous graph. It's called the hockey stick graph, because it gets to about 1950 and it goes, we're at 412 about now, 412 parts per million. And the last time that happened, there were beech trees growing in Antarctica. This particular graph I've got only goes back 800,000 years, but you go back 30 million years. And yes, there are various ups and downs, but you don't find a heck of a lot of people living at those points when the carbon is that high. By the way, the sea level at that time was 64 feet higher than it is today. 64 feet higher. So yes, there have always been fluctuations, but this is the first time it's been caused by human beings.
The other part of that is that those fluctuations occurred over hundreds of thousands of years. So there was a lot of time for plants and animals to adapt. This time it's occurring over not even 1,000 years, not even 500, less than 100.
So that's the real danger, is that there's not enough time for plants, animals, and to adapt. And that's our whole food chain. That's our entire food chain.
Thus, the J.P. Morgan study. Other questions for Dr. Sletten? Yes.
I guess I just have an observation and maybe a challenge to what we can do. I watched my wife teach environmental science for 30 years. And those kids have always responded so wonderfully. Yet it seems to me what's missing is, they go home and some have some reinforcement at home, others don't. And every day we see people make bad choices. We're all here, we made a choice to be here. And I personally have always thought that my practice and what I do at least shows other people that, that there's another way to do this. And so I guess I'm always struggling with how we can kind of bridge and overcome that gap or situation.
Anything? Thoughts, Paul? Or?
I'm just looking around the room too to see if there's any younger folks who might comment. I don't know if you heard his comment. I'll just see if I can paraphrase it. But the idea is, just how do we inspire the next generation to really follow through and support them? I think
those that are maybe connected to them, families, right? Because they play a big influence.
Yeah, no, definitely. So I'm a political organizer in Stevens Point. I work with Youth Get Out the Vote, and my organization is Next Gen. We originally started out as a climate organization fighting against climate change, but then we realized in about 2016 that young voters are climate voters. And for me, what I see more than anything else is that young people deeply and profoundly care about the climate, possibly more than other generations do, because they know it's going to affect them, but they don't have the tools to act out and to actually build up an institution and a structure that actually defends and builds them today. Right now we know that we do a survey. Right now the #1 answer on the survey just switched from cost of college at 86% to climate change at 87%. We've had over 45,000 people in the state fill out this survey. And the big thing that we're noticing is that we know that people care about this. The problem is getting them into institutions, getting them into places where they can actually take that knowledge and harness that to the next generation. So,
yeah, thank you for doing that.
Someone mentioned it earlier, but I think a big issue with climate change is people are overwhelmed by it because it's such a big issue. It's so complex. There's a lot of different factors that play into it. But I think trying to get people involved and motivated is to show them that there are a lot of different factors playing into it, so you can find your niche that really interests you and that you can really go for. And I think another piece of that, reinforcing environmental education or just education about the world around you in general, is really important at in home. And with climate change especially, I think it's such a politicized idea when it really shouldn't be, because it affects all of us. And so to show people it doesn't matter what your political beliefs are or what your background is, this is a real issue that's affecting all of us, and it needs to be talked about continually. It shouldn't be something that's focused on once a week, just for a 5-minute period in classrooms or at home. It's something that's in progress right now and will continue to be if we don't do anything about it.
You have to hit it on all different levels. And I started out this talk by saying that everybody in this room has something they can do. Every person in this room has something they can do.
So I think as a kind of young person, a lot of young people feel a sense of, one, hopelessness, there's not going to be enough they can do to fix things or make them better. And then going back to what he said a little bit with voting, we were actually talking about it before the presentation, that so many young people, they care about climate change and preventing it and all of that, but they don't feel like they have enough of a voice, or like them voting on it is going to matter or do much. So many people say, well, I don't really know what's going on, so I just don't vote, or, you know, like my vote won't really matter, so I just don't vote. And so kind of instilling in young people that their vote does matter, that like if our population as a whole voted more, like then we would have more of a voice.
Yes.
And I think right now we don't feel like we do.
Can I jump in for 2 seconds and say, how many of you have ever heard of this girl, really? Her name is Greta. Hands down. How many of you know her father's first name? His first name, yes, he does. His first name is Svante, S-V-A-N-T-E. He's named after a very famous person from whom he's descended, and the guy's name is Svante Arrhenius. And he discovered that carbon dioxide traps heat. He was a Swedish scientist, and he was the first one to establish that carbon dioxide traps heat in the atmosphere, and gives you some idea why Greta kind of took the path that she did. How many of you are college age or under college age? There we go. A lot of us in here are. I think there's an enormous amount that college students can do and are already doing, and high school students and middle school students are already doing, and we need to have them do more.
I know Greta's two middle names.
Oh, really?
One is Eleanor, one of my heroes, and the other is Tintin, another one of my heroes.
Yeah, we have good news with Citizens Climate Lobby as far as college students are concerned. Every year in June, when we go to Washington, D.C., we find money for scholarship money for students to go if they are not wealthy enough to go on their own dime. And we see at least 200 or 300 or more college students joining together, and they get really energized by this idea of being depressed over, well, it's an overwhelming issue and my vote doesn't matter very much and all of that. If you go to one of these events in June, I'll guarantee you, you will not be depressed, and you'll see that there's people from all 50 states, over 1,500 people going mostly on their own dime to get there. And it's very empowering to go in groups of 5, 6, 7, or 8 to members of Congress, either in the House or the Senate. It's just a tremendous experience if you like that sort of thing, and I love that stuff. That's why I keep going every year. But the reason that it's good news for college students is there is money available for those students who would like to join Citizens Climate Lobby. Give us a try, see if you like it. There's no dues involved, and see whether you would like to apply for one of these scholarships to go to DC in June. If you have any questions, Dan or myself or anyone else with CCL would be happy to answer them. Thank you.
Other questions, Leo? 350, I think, is planning an event called Vote-a-thon, March 3rd. If you want to speak to that?
Yeah, so, by the way, I'm Nick. I'm the secretary of 350, and we have a wonderful group of people that like to just try and organize events under this organization. One of those that we're putting together is called Vote-a-thon, and the aim of Vote-a-thon is to give like a non-partisan focused platform for people to come and get information on what it means for people to be issue voting. You know, like a lot of the times there are people who don't really know which candidate really represents the issues that they believe in. So the aim of this event is to get different organizations like Citizens Climate Lobby or League of Women Voters, and even like, you know, the college Democrats, college Republicans, get these people to get into one location and then allow students or even community members to come and listen to what these organizations have to say about politicians that they think represent their values. And yeah, I don't remember the date offhand.
It's March 30th.
Yeah.
And it'll be in the evening in the Laird Room.
Right.
And there'll be tables. CCL will have a table. The Interfaith group will have a table. I passed around a calendar of events coming up. One of them is a webinar this Monday at 11 a.m. And the link is on that sheet I passed out. And it's about what are the policy statements about the environment of the presidential candidates. So that kind of information I think needs to be spread around.
Just to clarify, so the League of Women Voters will be at the vote-a-thon. We are nonpartisan, however. So we're going to be talking about how to tell if you're registered to vote, how to register if you're not, where to register, where to vote, what you need to bring in order to get registered, that kind of thing. And I also want to say, especially to the young woman who spoke in the back and other people who feel like she does, the League of Women Voters is really strong about educating people about voting, and right now we have free memberships for students. So if you're interested in that, you can see us at the vote-a-thon, or you can see me after.
So I think this is great. I was very happy to hear that we're going to have 350. You know, Point, Nelsonville, Amherst, there's been this incredible influx of young people, active, creating things. However, I've witnessed and been around them enough to realize a lot of them are just overwhelmed with life. Voting can be difficult. Educating or understanding certain positions of different candidates can be difficult. You know, maybe one person stands up and says, hey, I think you should go this way, and it's like, really? You know, so I encourage all to help facilitate knowledge and education and voting opportunities for all.
Yeah, and I'd just like to add that there are many nonpartisan groups in town, and they're great, and they all will work on helping people to register and so on. But the candidate that does come out of the Democratic runoff will be a candidate who is for the environment. And so as somebody who works with both nonpartisan and the Democratic Party and progressive groups, I really want to encourage people to know that there are canvases throughout our area starting on March 21st. And those will be progressives and Democrats coming out of the Democratic headquarters. And those candidates are in favor of climate change legislation. And they are, you know, and it does line up with many of the nonpartisan groups' deep concerns. And so let's not leave out the fact that there is an active democratic movement in our region. And that, you know, if that's your ilk and you want to help, you can help directly to talk to voters. We use a method called deep listening. That is the same method that was used in the Obama campaign and also used by NextGen. And that method says, what is your most important issue? So I don't want to have a group like this meet and not recognize that this work is being done in our community by that particular party. And also those that are not in the party, but that are looking at candidates with climate change as their main focus. Give us a contact.
Anybody else questions for Dr. Sletten? Yes, sir.
Just kind of like a follow-up on the topic of like how do we make, you know, the issue of climate change and you know, self-realization popular in like younger generations. And this may sound kind of goofy, but I think like I'm gonna make a starting statement that, you know, younger generations are to some degree worried about what's cool, you know, like what they wear and the kind of who they express themselves as. And I think that to some extent we just have to do the little things in our lives and then make that cool. Like it's cool to, you know, buy secondhand clothes and not support, you know, these industrial complexes that just aren't doing things ethically. And, you know, make it cool to buy secondhand, make it cool to go out and vote, make it cool to bike everywhere you go. Just do these little things and like be proud about it. You know, it's easy to get discouraged nowadays with how many issues are hitting close to home. Like, you know, wetter, warmer winters, the crazy rainfalls, we have a lot of flooding and issues that Paul brought up today, but as long as we can do minor things and then own up to those and then make it seem appealing to the younger generation, that's a good way to start.
Thank you. And another round of applause for Dr. Sletten.
I just have a point of information here. There is an organization, this is for medical professionals, physicians, and really anybody who wants more information on how the climate change is affecting health. This is an international organization. It's called the Medical Society Consortium on Climate and Health. It is members of all different physicians, organizations, and professional health organizations belong to this. We got National Medical Association, American Medical Association, podiatrics, you get the picture, all kinds of them. And the mission statement of this organization is empower and amplify the voice of America's health care people to convey how climate change is harming our health and how climate solutions will improve it, which was really the focus of your talk this evening.
Could you say the name of the group again, please?
It's called, what I'm going to do is I've got all kinds of things here about this, just their mission statement. I'm going to put those on that table up there. And for those of you that have smartphones and like to take pictures of things, you can take a picture. I'll put this on that table up there too. But I've been on the website and it is excellent health information for anybody. So I will do that right now.
Thank you, Kathy. Before everybody exits, last few comments here. This is our second of 10 fourth Thursday climate forums. And we have about 4 or 5 different organizations who sponsored this. I mentioned their names. There will be even more sponsoring the following presentation. Several church groups and other organizations as well, such as the North Central Conservancy Trust, the League of Women Voters, Peace United Church of Christ, Point Fellowship. Anyhow, there are going to be a lot more sponsoring the future ones. Fourth Thursday of next month, our presenter will be a fellow you may have heard of. His name is Chris Holman, and he is our Portage County executive, and he is also the co-owner of Nami Moon Farm. And his topic will be Farmers' Challenges, Climate, and More. That will be in this room at 6 p.m. on March 26th. The following month, there will be a presentation entitled Climate Change Solutions. And this will be by Pat Drees, who is here with us now. Raise your hand right back there. Pat Drees, thanks, Pat. I'm really looking forward to this one. He will be explaining, he's been getting lots of training in a software program developed by MIT. It's called the En-ROADS Simulator. And what it does is it enables you to put in, say, we all shift to electric cars. What does that do in terms of climate change? How will that improve things or make them worse? We do this. We reduce our travel on airplanes. How will that affect climate change? We implement say, a carbon fee and dividend approach. How would that influence that kind of stuff? So you can do all this stuff on this simulator and it will give you information about it. Looks to me like a fascinating presentation. We're going to have these fourth Thursday presentations every fourth Thursday right up to the election. And the idea will be to help educate all of us on this critical matter. Why am I here today? I am here today because I brought this with me. This is the thing on which you sign up if you would care to join our organization, Citizens Climate Lobby. We can't do this alone. We've got to do it together. If you'd like to instead join the Interfaith Community for the Earth or at 350 Stevens Point, see one of the people whose hands were up before, we'll kind of cluster over here. We'd be delighted to have you. Right there. Yes, sir.
I was saying 350.
350. He's the one to see if you'd like to, if you're a student. Right over here. talk to him. Thank you again for being here, and together we will keep this a livable planet.